name is Crystal James, and I'm going to talk about my 5-year plan. A little bit about myself. My name is Crystal James. I work as a day shift charge nurse in the emergency room. I have been interviewed by several publications as a medical expert. I have gained vital experience and I have managed to implement 2 evidence-based changes within the emergency room, having accumulated 1,500 clinical hours providing direct bedside care and emergency room care, which gave me the vital expertise in my field. I plan to further my career by undertaking my master's in nursing and increase my experience while making considerable contributions to the nursing field. Humanity and society construct. This outcome was met during our simulation class. We practiced how to care for a patient focusing on the patient's needs. Remember, we have to focus on the patient's needs. Involving the patient in the care plan by informing them on the plan of care. We made use of what we were taught in class to offer the best care to the patient. We conduct research to improve on my knowledge regarding the patient's condition. We offered advice that is backed by research in order to improve the health of the patient. Improving the care offered to the patient using evidence that support the need for changing nursing practice. Lifespan Health Continuum Construct. Undertaking the independent learning activities that required us to conduct research. There were assignments that were targeted towards increasing our knowledge of this construct. Patients advocacy was practiced with my peers. We practiced on how to deliver sensitive information and offer advice to the patients. Now, when we provide sensitive information, we made sure the patients were sitting down. We made sure that if anything was to happen while we provide them with sensitive information, we were there to help catch the patient and prevent risk for falls and everything else. During our practicals, we had played different roles in order to determine the background of the patient. We interact with patients with an aim of establishing their health care needs. Evidence-based practice and clinical reasoning construct. We conducted research with an aim of making suggestions to change in practice. We were presented with cases and we had to conduct research to determine the best course for treatment. Research is always the best way to determine what is best for the patient. One had to use the best approach and back it up with research. Assignments required us to present the nursing process for diagnosing and treating a patient. Simulations for emergency care was done where each one was required to attend to a patient with limited information and they had to make use of their reasoning and critical thinking. Now, with the simulations providing us with limited information, that's when the critical thinking portion of the nurse had to come in, because you had to make sure, okay, we're covering every aspect of this scenario that's going on. We can't leave anything out, because if you leave anything out, guess what? We can fail on the patient, and something that we probably missed could contribute to something else, and we don't want to mess the patient up. Okay, patient and client-centered care. We had to interact with other healthcare professionals via simulation, and I thought that was very good. By interacting with other healthcare professionals, that helped everyone become on one path to try to determine what was best for the patient in order to provide best patient care. The interaction required us to offer suggestions that are aimed at offering the patient the best care. Focusing on the needs of the patient and his or her family was the main requirement. As long as you focus on the needs of the patient, of his and her family, that is one of the best ways to help make the patient happy while providing patient care. Include them in their care, their plan of care. Conducting research and synthesizing the information for presentations to others on why a certain method should be used was encouraged. We learned nursing theories in the class, and we had to employ what we had learned to a particular patient scenario that was presented to us, which I think was very good too, because once again, that's when the critical thinking portion in nursing came in. Professional roles construct. We learned about the ethics of nursing and that of caring for patients. Practicals were given where we had to analyze the information presented and determine the ethical approach of the situation. The role of nursing and the different roles for nursing were discussed in class. We had to determine these roles during an assignment. There were oral presentations assignments where one had to communicate their plan of care and be prepared to defend their choice of care. Students were encouraged to question the information presented. Communication was practiced with the nursing students where one had to play roles of a patient and the other a nurse. Now basically some of the ways that we could back up the information was with evidence-based practice, and then bring in the theories like Florence Nightingale, Jean Watson, that helped us to clarify some information. Professional roles construct. Role playing was the best way one could get the vital experience of how to deal and handle different patient scenarios. Role playing is very good because some people are visualizing. Like me, sometimes I need visualization to help catch on if I'm not doing it hands-on. But hands-on nursing practice was also provided under the strict guidance of the lecturers at one of the hospitals. And hands-on is very good too, because that also helps me too. Visual, role-playing, hands-on. The assignments were given required us to visit care facilities and interview or observe a nurse in practice. This prepared us for an actual job, which was very good. Some people know how to do the process, but then they don't think. They get so tied up when, oh, this is nothing, I can do this every single day, and then turn around, they're messing up. They're not doing it the proper way. So observing them helped them out also. Taking instruction and handing over patients to the other nurse at the end of the shift was also described. Vital communication was taught and was practiced both in class and in simulation. I think that was very good too, because when you provide end of shift report, that information needs to be correct accurately, so we can make sure that we provide the patient with accurately care. Now, for my 5-year career plan, year 1, I want to finish nursing school and begin working as an RN in order to gain experience and to get an idea of the nursing branch I would like to specialize in. Year 2, I want to gain more competence, perhaps get my ACL, as I plan to do adult nursing mostly. Conduct research on the branch of nursing to pursue and seek advice from my mentor. Year 3, I want to continue improving my nursing competency skills. Start to fill out in one of my chosen specialty fields to determine if it's a good fit for me, because I never know. Year 4, I want to apply for a job in the selected special field that I choose. Now, after I get my baccalaureate, then I will move to my 5-year plan, which is start planning to do my master's program and maybe become an NP, nurse practitioner. Thank you very much for listening to Crystal James' 5-year career plan. Thank you.